Welcome back to the Morning Blend. Well, Menopause, the musical, was an international sensation. It used hot flashes, mood swings, and memory loss to make a hit show. Today, we're not going to sing about those things, but we are going to talk about them.
You got that right. Dr. Shahira Cotter is a women's health specialist and menopause practitioner with Aurora Women's Pavilion. Thanks for being here, Doctor.
Good morning.
I think it's a very, good morning. I think it's a very important topic for many women. But first of all, before we get into some of the details of menopause, what exactly is it, and what are some of the signs and symptoms?
Right. I mean, you absolutely mentioned, right, menopause, a very natural biological stage in a woman's life. Average age in the country is about 51, and a very clinical diagnosis. A woman, after going through 12 months of absence of period, is when we define it as a menopause. Now, it can happen artificially too, say with a surgery where there's removal of the ovaries, or after medications that might cause suppression of the ovarian function. But you know, we hear so much about the symptoms associated with menopause, and that's with the the changes in the hormones that go along with it. So regarding the symptoms, there's the hot flashes and the night sweats that are commonly talked about, but there's just so much more. I mean, there are the neurological symptoms of headaches and difficulty concentrating, loss of memory, changes in sleep cycle are very common. Also very common urinary symptoms of urinary frequency, incontinence, frequent urinary tract infections, sexual symptoms such as decreased libido, vaginal dryness. And then again, symptoms that we might not directly associate, such as dry eyes and bowel changes, joint aches. So I think that's why it's so important for women to be aware of the possible changes, so that they know what to expect. Plus, these changes can set in many more years before menopause. And so, especially because of how variable it can be in the duration, the nature, and the severity, I think it's really helpful when they're able to seek care so we can provide the appropriate support.
I think, just listening to you and knowing that it's a natural part of a woman's life, but none of those symptoms sound very fun. In fact, they all sound like something to dread.
Absolutely.
And I wonder, for people who are suffering with these symptoms, what can you do for them? Are there ways to treat it, or is it just like, hey, you got to suffer? How long does it usually last, these symptoms?
I mean, you're absolutely right. All these symptoms do lead to a lot of psychological symptoms too: irritability, anxiety, depression. And the symptoms, they can actually start in the perimenopausal period, so years before menopause actually sets in, and it can last for a few years after. So as far as what we can do for these symptoms, there's a lot of options, be it medications from different classes. There's also botanical treatments, there's supplements, and there's also the option of using hormone therapy in the topical or systemic forms. So when a woman comes to us, we begin with this evaluation process and make sure that there's nothing else that might be contributing. For example, there are times when a dysfunction in the thyroid gland could mimic some of the symptoms, or say in the vaginal symptoms, we make sure there's no dermatologic conditions of the genital tissues that might mimic some of the symptoms. And then we review the options, and it's really gratifying to be able to work together and come up with a plan that is best suited for each individual based on their symptoms and their history and their beliefs, really, towards the treatment options.
And I think that's important because as women, it's inevitable. We will all go through it. We will all have some sort of symptom, and we will all face menopause at some point. And so one thing that you also do is use integrated medicine. Talk a little bit more about that and what that is.
Sure. Integrative medicine is it's holistic medicine. It approaches the person, the whole person, mind, body, spirit, and all aspects of lifestyle towards reaching optimal health and wellness. It utilizes all appropriate treatments. We do use conventional treatments, complementary therapies, alternative treatments, and there is focus on disease treatment as well as on promotion of health and preventing illness. I really like that the partnership between the patient and the practitioner, where we're working towards this healing process, and the patient takes control of their health. And you can imagine in many of the women who are struggling with the menopausal transition, some of these strategies have been really beneficial.
And beyond those symptoms and kind of trying to manage that, are there health issues that tend to also affect women at this midlife, at this time in their life?
Sure, you bring up a very good point. I mean, irrespective, some women are really lucky, they don't have the symptoms, and irrespective of whether you experience the menopausal symptoms or the degree, our bodies go through change during menopause. And for example, with menopause, there's increased risk for heart disease and osteoporosis. So the estrogen that is present in the reproductive years, as it goes down, estrogen has with the decrease in estrogen, there's a change in the cholesterol profile, or there's an increased tendency for the buildup, the fatty plaques to build up in the arteries. Similarly, when it comes to bone health, estrogen has a protective effect on bones, and it's been found that during the menopausal years there's accelerated bone loss. So when someone comes to us, we can determine, does this particular patient require screening, for example, a bone density screening, sooner than the recommended guidelines? Or we can also recommend the appropriate intervals for screening, such as routine mammograms, pap smear, colonoscopies, immunizations, again based on each individual's age, their personal history, their family history. And for women who go through menopause, especially, maybe looking at would they benefit from any additional interventions. For example, do they need referrals to someone who specializes in bladder health or sexual health or cardiology or endocrine? So that's helpful, I mean, to be able to kind of provide that comprehensive care.
And it seems important to see a specialist, too. Yeah, and I know people can contact you for more information, and in order for people to find a physician who can help manage your health during menopause or any life stage, you can visit aurora.org/findmydoctor, or you can call this toll-free number on your screen. It's 1-888-863-5502. And be sure to mention that you saw the doctor here on the Morning Blend when you call that number or request an appointment. It was so nice to have you here today.
Thanks, Dr. Cotter.
Thank you.
Appreciate it.